Hi, it's Constanza Roeder, and I'm here in Austin at the National Conference for the National Organization for Arts and Health, and I'm here with our president, Todd Frazier, and he is the director for Houston Methodist Center for Performing Arts and Medicine. Did I say that right?
That's right.
Okay, so tell me a little bit about what you do over in Houston and how the benefits that you see the arts and health play in healthcare over there.
Well, I'm the director of the Center for Performing Arts Medicine at Houston Methodist Hospital in Houston, and we really try to optimize that collaborative relationship between the arts and medicine and harness that potential within the healthcare environment. For us, it's an extraordinary application, meaning that it touches folks throughout the entire patient continuum, from the minute they walk in the hospital, the checking in, if it's a treatment or a procedure, their time in their room, the time they're spending in rehab, and usually the last thing they hear or see when they leave is music. For our hospital, I think it's an ethical consideration, as well as, frankly, an economic consideration as well, is to treat the whole person. And in treating the whole person, I think you're checking all the clinical boxes, but you're also checking all of the ethical boxes and all the value boxes. At the end of the day, it's doing the right thing. It's helping people, and it improves outcomes. It lowers the cost of care and improves outcomes. And those two things, lowering cost of care, improving outcomes, every single American hospital today is working on how to do that. And the arts are absolutely a solution, one of the solutions for this challenge in America. So I think the time is right. I'm glad you're here at the conference, learning about what you're doing, and that's what we're tackling here in Austin this weekend, is how we can unite the field and elevate the conversation for the role that the arts can play.
That's awesome. So where do you see the arts and health going in the future in our country? Because I know it's going on all over the world, but where do you see it? Where do you see us in the next 5-10 years?
I do really feel there's a sort of renaissance going on in this field. I mean, there's a lot of growth. I think for a while it's been hard to articulate the benefits in more of a traditional scientific ways. But actually, with the advance of some modern assessment tools, specifically like the fMRI, and how we're now able to do cortisol swabs with saliva, these tools are really helping our cause. We can really now track with biomarkers the differences that we are making in anxiety and in resiliency and in pain, and ultimately positively contributing to the outcome. So I think it's moving from, let's say, more of a softer science to absolutely a harder science, and it's actually thanks to a lot of the technological advances. So I think that's going to help. I already see it helping. I think it's still, even though the idea of caring for each other through methods of inspiring each other and through the arts have been with us from the beginning of time, as far as becoming standard of care in the U.S. health system. It isn't that yet, but it is the vision of this organization to try to professionalize our field in America so that the arts and health are an integral part of health and well-being, and I think we're well on our way.
Awesome. Well, thank you so much for your time. I know we've had a really long day of workshops and everything, but thank you so much for your leadership in this area, and we're excited to be here and learn more and bring it back to San Antonio. So thanks for watching, and we'll see you later.